Ladies, I have some exciting news. It is finally our turn. So I want to tell you about the Juliet Vaginal Rejuvenation. The reason we love the Juliet is because it is erbium YAG technology. So when we went out to find something that can help all of our patients with urinary incontinence, lubrication, just painful intercourse, these are all things that are going to affect your lifestyle. It's going to affect your marriage or your relationships. And we want you to be able to be your healthiest. And so when we went shopping, we tried out multiple other devices. The reason we love the Juliet is because erbium YAG loves water. And I figure with all the other things as women that we go through, childbirth, periods, menopause, this should not be something that we should have to endure. And so we found the most comfortable vaginal rejuvenation laser on the market, and that's why we brought you the Juliet. So the Juliet, what we do is it's almost like getting an intravaginal ultrasound. It's a little probe. It goes into the vaginal canal. It delivers erbium YAG energy in a 360 fashion all throughout the vaginal canal. Afterwards, during the procedure itself, you actually don't have very much pain. Even afterwards, there's a little bit of discharge, but not really a lot of pain. Most of the time, we recommend that our patients do about 2 to 3 sessions, maybe a 4th if you're already in your menopause. The way I like to tell my patients, count 1 for every kid you've had. If you've had an episiotomy or any kind of tears through childbirth, then add an extra 1. And if you're past menopause, then we definitely do need to keep up with that estrogen loss. The goal of the Juliet is, as we're aging, your lamina intima and your lamina propria, these are these smooth muscle layers that live on top of your actual muscle in the vaginal canal. And so these layers are getting thinner and thinner as we're aging. The goal of the erbium YAG energy and the heat is to plump it up, to build that collagen, to build that thickness. And when you build that thickness, you're making that vaginal canal healthy, moist, pink, tighter. It does help with, the first thing you're going to notice is a change in lubrication. Definitely after the first session, you'll notice an improvement. The collagen building and the urinary incontinence, that takes about 2 to 3 months after your final session for that collagen and that thickness to build up. Maintenance for Juliet, we recommend doing 1 per year if you're already in menopause. If you're not in menopause yet, then you can certainly go every other year. Believe it or not, this is the one treatment that we actually don't have to tell our patients to come back for. Most of our patients, they just know, hey, you know what? I can feel it. I know it's time for me to come back for my touch-up treatment.